Thanks for joining us for On Call for All Kids. Today we're talking about the latest in coronavirus and how it's affecting kids. We'll be going over coronavirus symptoms in kids, the latest on returning to school in the fall, and advice on doctor's visits and play dates. I'm joined by Dr. Juan Dumois. He is a pediatric infectious disease physician at JohnsHopkinsAllChildren'sHospital. Dr. Dumois, it's great to see you.
Good to see you too, Ashley.
Let's talk about what's going on in the Tampa Bay region as it pertains to COVID-19. What are we seeing as far as this pandemic goes?
Well, currently what we're seeing is that the number of new cases of people infected with the coronavirus have stabilized. We're not seeing a big increase at this moment. We're going to keep a close eye on that, though.
Now, is it true that COVID is pretty much only affecting the elderly and those with underlying medical conditions?
Well, those people with underlying conditions and the elderly are at a higher risk of getting sick enough to be hospitalized. But we know that the coronavirus also can infect healthy younger people as well. We do know that children who get it tend to have fewer symptoms and their symptoms are not as severe. So some of the symptoms that these children can get include fever, they can have a cough, they can have a rash, they may have a loss of sense of smell or taste, they can have a headache, diarrhea or an abdominal pain, they can have muscle aches or even shortness of breath.
And how about this new pediatric multi-system inflammatory syndrome that we're seeing in kids? What do we need to know about that?
Yeah, this pediatric multi-system inflammatory syndrome is also called multi-system inflammatory syndrome in children. And it is a new condition that resembles Kawasaki disease and toxic shock syndrome. In this new condition, the children have fever for at least 24 hours. And they also have other symptoms as well. Some of the other symptoms that they'll have are unusual weakness or fatigue, a red rash, belly pain, vomiting and diarrhea, red cracked lips, red eyes, and swollen hands or feet. When children get this condition, they look miserable, and they can often have involvement of the heart, where the heart becomes weaker and cannot effectively pump blood to the rest of the body. So children with this condition have to be evaluated and cared for in a hospital setting. It is treatable, but it is a serious condition.
So when should parents consider taking their sick child to the doctor?
So children or parents should consider bringing their sick child to the doctor when the child is developing a rash, if they're really clingy or fussy, sicker than they normally look when they have a cold, and they're just not sure, that is a perfect time to take them to the doctor. I think that it's important that they don't hesitate too long before bringing their child to be evaluated by the doctor if they think their child may be developing this condition.
I want to ask you, what are your thoughts now on potentially getting together with friends and play dates with other children?
So we have to remember that the pandemic is not over, and it's going to last on into next year. There are a couple of reasons for that. The first reason is that this virus is so contagious and it's very easy to spread. So it's going to keep spreading, even if it's spreading at a slower rate. And the second reason is that most people have not been infected. So based on reports from Johns Hopkins Medicine and other reports, we know that most of the country do not have immunity. In most studies, less than 5% of people tested for antibodies do not have any evidence of immunity. And so most people, therefore, outside of the New York City area, they haven't had it and they can get it. They are possible spreaders of the virus. So given that, it's a little risky to let your child have a play date with other kids. It is important that if they do go outside the house to maintain social distancing, they should avoid direct play with other children. They should wear a mask. And it's especially important that they wear a mask if they can't do social distancing, staying at least 6 feet away from all other people outside the family.
Well, knowing that this pandemic is not going away anytime soon, we are starting to talk about, hey, what does the school year look like in the fall? So what are your thoughts? Are kids going to be able to go back to school?
I think that children may be able to go back to school. It depends upon the conditions for the pandemic in your area where you live. It can be different in different communities, which may have more spread of coronavirus than other communities. So in some communities, and I'm talking about in August, just a few weeks before school starts, that's when the schools have to be talking to the public health authorities to figure out, is it safe to go to school? And if it's safe to open the schools, then the schools will have plans in place to try to keep the children and the staff as safe as possible.
Well, Dr. Dumois, thank you so much for joining us today.
You're welcome, Ashley.
We really appreciate hearing all of the latest in coronavirus updates. And thank you all for watching. We appreciate you tuning in. If you have any topic ideas you would like us to look into, you can comment below right here on this video. And you can also visit our website. It's hopkinsallchildrens.org/coronavirus, and you will find a lot of great resources there as well. Thanks for watching. We'll see you next week.